Excellent. Thanks, Steve. Next, I'd like to introduce Hollie Smith and Heidi Huber-Stearns. Hollie's an associate professor of science and environmental communication in the School of Journalism and Communication at the University of Oregon. Heidi Huber-Stearns is an associate research professor and director of the Ecosystem Workforce Program at the University of Oregon. So please come on up.
Perfect. Thank you so much for having us today. So we are going to talk a little bit, following up on Steve's talk about the actual experience on the ground in Oak Ridge for the Cedar Creek fire, for both the evacuation and the air quality. So we were invited, we actually had a pre-existing relationship. We work with Oak Ridge Air on other research projects. So we had a pre-existing relationship with Oak Ridge Air. After the Cedar Creek fire, we were invited to facilitate an after-action review, which we went down on December 5th and facilitated that for the city of Oak Ridge, people in Lane County, and anyone who was involved in the emergency response for both the evacuation and the air quality event. So we focused on what went well, which is what I'm going to talk about, what could have gone better, and some recommendations, which Heidi will talk about. So again, we did focus on evacuation and air quality. We thought about separating the two since this panel is just focused on air quality, but they happened together, so we wanted to talk about both. So as was mentioned, there was 37 days of air quality that was unhealthy for sensitive groups between August and October. We're just going to focus a little bit on the timeline for the community response here. So around September 6th is when multiple cleaner air spaces were opened within the community. September 9th and 10th, when a level 3 go now evac notice was issued. Again, about 3 days later, that was downgraded to a level 1. September 14th and 16th, the mobile pantry opened and the shelter closed. So many people, when the power was shut off for public safety, they lost all of their food in their freezers. So there had to be mobile pantries for the community at this time. Around September 19th, purple air monitors were put in schools in Oak Ridge. So the Early Learning Center, the elementary school, and also the high school in the gymnasium. So multiple purple air centers were actually put indoors to monitor the air quality indoors. Purifiers were also lent to the schools to put in the classrooms because this was an extended air quality event. They were put in classrooms and also sent to a local healthcare provider to go home with patients. A little bit after that, the purifier distribution of the 1,000 air purifiers began in the community, and different community members became eligible for purifiers at different points in time. So again, starting with vulnerable populations, and then around October 13th or 14th is when anyone who didn't have an air purifier in their home became eligible for an air purifier. You could just go and pick it up through this purifier distribution process. So by end of October, again, 1,000 air purifiers had been distributed to the community, which is actually a substantial portion for a community like Oak Ridge, and all of the remaining evacuation notices were canceled. So what went well? So the community was actually anticipating the public safety power shutoff. That had been communicated successfully. So they were actually able to print all of the evacuation signs and put those up in advance before the power went out. So they really thought about this also for cleaner airspaces and printed all of the signage and all of the communication in advance of the power going out. They also said that the evacuation was successful because the community had been through this before. So they have evacuated before, and they said about 75% of the community actually evacuated from the city of Oak Ridge and surrounding area. Many people actually said that residents had left in advance of this, actually before the level 3 was issued because the air quality was so bad. Again, people actually said that communication was fairly strong in terms of social media, signage throughout the community, and also word of mouth. Again, Oak Ridge Air it did exist in the community, so there was infrastructure there already in place, which I think was vital to the success of this. And also the availability of public transportation for the evacuation. There were more buses available than they actually used. In terms of the smoke, more than 1,000 air purifiers were distributed to the community. This actually took about 500 staff hours, but also more than 500 volunteer hours. And they estimate that because they did actually have to verify eligibility, that it took 1 hour per purifier to be distributed in the community. So it was a significant lift for those staff and volunteers. At this interface, people were coming in to pick up their purifiers. The majority of people who got a purifier signed up for a text messaging service that was run through El Rapa, and so they were actually signing up to receive additional information, which was a huge win. People knew where the cleaner air spaces were and utilized those, so that was a big success. People also saw the installation of indoor air quality monitors as a huge success for their community as well. And the last thing is people were reporting because of the extended nature of the event and the fact that children couldn't go out to recess and they couldn't play outdoors. Toward the end of this, there was a field trip that was organized, and children were actually bussed out to a space where there was clean air. And that was a big success that the community said was actually needed in advance. We needed more of those. And also there were recreational passes given to Willamette Lane up in Eugene where air quality was better, so families could come up and actually recreate. So those are the things that went well. Now I'll turn it off to Heidi for things that could go better.
Thanks, Holly. And I think congratulations to whoever organized this panel, because I think we were set up really well to talk about this as the third section of what happened. And I think I'm going to talk a little bit about some of the recommendations. So for time, we're skipping over the what could be done better and rolling it into the recommendations. But just a couple things to maybe step back from this and say, we know these events will happen. We know both smoke from prescribed fire, smoke from wildfire, as well as evacuation. And so thinking about how we are increasingly living in these smokier environments in Oregon is something we all know is the reality. And so, to Doug's points, how we communicate, coordinate, all of that prep time is really what a lot of this comes down to, and a lot of what our recommendations are about. And in all of these, not just in Oak Ridge, but Oak Ridge as kind of an example of a rural place with prolonged events, with a high population of medically vulnerable and less mobile individuals, as well as different types of communities needing different types of culturally appropriate communication. This is something that we see across communities in the Pacific Northwest. And harder to access populations. A lot of the population does not have access to cell phones, internet, or landline. And so thinking about kind of that combination of things when you're doing things like evacuation or smoke communication is really critical. And also thinking back to Rick's maps of social vulnerability and where some of the air quality challenges were, we know this is something that we're going to be living with. And so thinking about how we take the lessons from this community, not just for them, but to other places to consider the things that can be done moving forward, all of which take funding and resources, as we know. So keep that in mind when we go through some of these. But to start, one of the big recommendations was about an internal and external communication plan. So again, ahead of time, really establishing a central communication hub so that when an event happens, you know where the information is going to be posted for external stakeholders. Also identifying roles for who will be doing what, both at the city and county level ahead of time. Some of this, of course, is in some of the plans that they already had, but really getting clear about some of that, as well as where and how to conduct community briefings. One of the things that we know is it was really hard on community staff members to try to communicate in all the places that they needed to be while also being responders. And so thinking about how to streamline some of that, having multiple communications channels that go beyond social media and emails, where signs are posted, reader boards, but those only work if you have power, so thinking about how you navigate some of that. Also planning for multiple scenarios, planning to have power and to not have power, and planning to have a disaster declaration or not, which can change the resources available to a community. And then even things that sound basic but become really critical in the moment when staff are stretched thin, like drafting web pages and email templates for different scenarios ahead of time, so those are essentially pre-populated and ready to go. Other recommendations were around increasing staffing and resources, obviously, for community emergency response and planning, including, again, planning with and without electricity and with different levels of support from the government. This idea of how much does the local community need to be able to do and having tiered plans that respond to that is really critical. Having paid positions, ideally, to expand and oversee emergency community response ahead of time is a critical part of this, as well as including things like being able to take the list of people that signed up for air purifiers, a list that included people that had no other direct contact or way to learn about smoke and evacuation events, and using that to do other community outreach ahead of time was another part of this. Also, designating roles for briefings. Again, the clear role piece is really important here. And establishing an emergency operations center was another key recommendation for this area, with a backup generator, fuel, and other supplies. And again, with all of this being able to pivot, Oak Ridge went from printing signs directing people to clean air spaces to flipping that around to say level 3, evacuate now, right? So being able to be flexible in that space is another key part of this. And then the air purifier distributions, just having clear eligibility. This was definitely a learning space for everyone as far as who was eligible and who met the definition of vulnerable populations. Also, by the time most of the purifiers were distributed, people without text messages found out about them, but most of them were gone at that point. So thinking about how you navigate getting that information out to people in these types of urgent situations. Also, just things like which air filters have better functioning over time. And the cost of air filter replacements can be a pretty big cost for individuals. So having those available or making sure people know that that is something that needs to happen with filter replacement. There's also some lessons learned around it's better to have models that have the AQI listed on it. People prefer that. Certain models worked better than others. And so thinking about what's going to work best for the community ahead of time and be more effective for air purification. And then again, access, just reaching people without internet in particular and landlines. And then this other piece that Hollie mentioned too about increasing support for public schools. I think we cannot underestimate the costs of these prolonged events on mental health, physical health, well-being for everyone, and including in schools. Not having, I think as Steve mentioned, not having indoor air quality regulation means the guidance that schools have about what they're doing and where they're doing it and how is pretty limited, and providing more resources and support for that is another key part of what Oak Ridge would like to do moving forward. And then again, just anticipating how do you create these multiple plans and resources and know that you might be navigating prolonged smoke events and or evacuations at the same time. And then the final one is just providing additional training capacity for mental health impacts and community trauma, like we've just been talking about, and thinking about ways to do that, and particularly supporting local organizations in that space. And I'm going to end there and just let you know where our contact information's up here. Our partners are reviewing this report that we've put together for this after action review, and so happy to share that or talk more about this and learn from you all. Thanks.